Welcome back to Vital Signs with Jen. We are going to shift gears and talk all things infertility today with our resident expert in fertility, Jessica Preston of Novo Fertility. Jessica, welcome back.
Thank you for having me back, Jen.
I'm really excited to dive in because we were talking about this before the show, and there are three categories of infertility. Shed some light on what those are and what those look like.
Okay, so the best way to, when there's so much for infertility and we get in that boat and we get very confused and scared. So the best way to look at this is in three separate categories. One category is structural, and what that means is there's something wrong with the anatomy itself. For example, fallopian tubes are blocked, or on the female factor, male factor may have a varicocele, female factor may have a problem with the endometrium, with the lining. And so that is about 40% of fertility issues, infertility cases. Then we have another group which is classified as other disease states, and I don't love the name disease, but a diagnosis. So thyroid disorders, other autoimmune conditions, those fall into that category, and that would be that's about 11%. And then there's the other category, which is about 49%, which we put under the umbrella of hormonal disorders. Those hormonal disorders may be things that we can diagnose, such as PCOS, and they also may be hormonal imbalances that are subclinical that we can't diagnose. And so that is where functional medicine does a lot of magic in that, and that's where unexplained infertility resides. We don't have a structural definition, we don't have a disease state definition, and we have this syndrome state, or we have this overwhelming amount of hormonal imbalance. So that's where that unexplained infertility that we've talked about a lot comes in.
And so that's half of the game right
half
there.
The game. Yeah.
So if half of the game is in this nebulous, we have something that's not diagnosable state, how is it that we are able to address that area? What does that look like? How, like you said, it's very common that's the majority of people. Mm-hmm. So what does that look like? Is that I'm too stressed out at work? It's mm-hmm. I'm trying too hard? Like, give me some examples of that.
Right, so it is. So when we say I'm too stressed out at work, it's so hard. So I want to have our conversation, but also put with this, since we don't have people present to ask us questions to help their stress mm-hmm. when we call their stress out, to say, even if we say it's because you're stressed out at work, that doesn't mean that you should then go home and say, I'm too stressed, which is what we do.
All right, perseverate on it.
Yes, so we need to be cautious when we bring forth these issues. But when we talk about stress, for example, our body, when we are stressed, impacts our autonomic nervous system, which is our fight or flight, rest and digest system, which then changes the chemistry and balance of some hormones that then will impact our our sex hormones. That sounds like a lot of words to say that, but yes, stress can impact that. So when we can find ways to decrease stress, then that can definitely help with that balance of hormones. So stress would be one. Environmental factors like toxins, perfumes and toxic chemicals that we use to clean our home. Not sleeping appropriately. When we don't have adequate sleep, then we also don't have adequate our hormones for fertility. And exercise. If we over-exercise, we actually cause a cortisol spike, and cortisol is that stress hormone mm-hmm. that also causes an imbalance. So these are some of the ways that we can address these issues when it comes to a functional medicine approach.
So I'm going to ask a question, because there's a lot of different areas. They're all lifestyle areas or little tweaks that you can be doing to help facilitate. And we've talked about a lot of these on the show before. But if we fall into this majority, I'm going to call it a majority, mm-hmm. And we're experiencing these symptoms, these challenges, like, what is the one takeaway that I could do today that could help get me move me along in my journey? Or what is the one thing that I need to ask my doctor, for example, because I'm trying to conceive and I'm not, and so I'm getting concerned about it? Like, what is that magic question or the thing that I need to ask to my practitioner or provider so that I can actually move this ballgame forward?
So when it comes to conventional medicine, I think the majority of OBGYNs the generalist space and a lot now of the IVF space are understanding that there are some alternative things or holistic things that can be done to be able to improve fertility. We're getting more research, we're getting more data, so we're getting a lot of more support from the conventional medicine community. So asking where you might be able to go for some assistance with that would be great. If your provider says none of that helps you, I would probably ask for a second opinion to see if there is another person who might be able to guide you somewhere that can give you some help. I think it's important to know that you can still have hope. Little tiny steps do make big differences, and just understand that it's scary, and we know it's scary. It's okay for it to be scary, and just kind of take a little bit of a breath and try to make some move forward.
And I think above all, what I'm hearing kind of throughout as a theme is don't perseverate on it. Don't worry about it, because the more we tend to perseverate and think about it and think about it and think about it and worry, it only builds a bigger problem. So interrupting that pattern and having some grace with ourselves, with our partner, is a really good first step as well.
Yeah, if you are perseverating, please be sure to, we need to find help, because sometimes when we tell ourselves to stop overthinking, we every time we say stop overthinking, we can't stop overthinking.
We have a big brain. Our brains are wired to think.
That's exactly it. And so find some help. Talk to your partner. We've talked about partners before a lot too. Talk to a mental health specialist. Talk to somebody who works in mindfulness. Talk to somebody who works in functional medicine. Talk to somebody who works with polyvagal theory. All of these are really, really helpful areas to be able to get tools where you can stop yourself from that perseveration and maybe give yourself some kindness. So if we can stop ourselves and try to stop thinking, there's one little tool that I'd love to give you.
I'm so excited. I love tools.
So I can't remember. I'm so sorry. I can't remember where I learned this from. But if your brain is going and going and going, I want you to think to yourself, what is your next thought going to be? There isn't one when you think that.
No,
and it actually stops you from thinking. And so it just gives your moment a pause. It gives you a little bit of a pause and a little bit of a breath, and then maybe you can even laugh a little bit at it. There's that stop and notice that you're thinking too much. Notice there's an emotional feeling with it, and then allow that emotional feeling to sit with you. Try not to think about what made you feel that way. Just let it sit in your body, accept it as being human, and then try to let it go.
I love it. So the next time, and this applies to anything.
It does,
when you're
really.
worrying about anything, you're worried about the test results, you're worried about anything, just stop.
Yeah.
And what is my next thought going to be? It literally stopped me in my tracks. That was fascinating.
It does.
Hopefully you tried this at home.
Yeah.
Okay, Jessica, so for everyone who is listening and watching, they've been following you, they've been watching this because we've had you on a couple of times now. Like, what is it that they could do? How can they reach out to you so that they can start this journey, get the support? Stop thinking.
Stop thinking. Well, the one other point I want to make is if we have these three categories, even if you're in one, it doesn't mean you're not in another. So make sure that all three categories are assessed. So if you have one of those hormonal imbalances, it doesn't mean you don't have a structural issue. So make sure all three areas are looked at, and that can be done in conventional and functional medicine.
Fantastic. And so just because you're in one category doesn't mean that you're not in all three.
Yes.
I love it.
That's true.
How can we reach out to you so that we can get this ball rolling and get the party started?
Thank you so much. So we are at denovofertility.com. That is our website. You can sign up for a phone call with one of us. You will not speak with anyone from a call center or a receptionist. You will get somebody that actually works with you through one of our programs. We have a number of programs there. You can also find us on all social media. We're on Facebook, Instagram, TikTok. On Facebook, we're De Novo Fertility Community. On Instagram, De Novo Fertility, and same on TikTok.
Fantastic. Thank you so much for joining me again today. You are always a wealth of information, and everything that you bring is something that's useful for everyone, even if they're not on a fertility journey. So thank you for that.
Thank you again for having me.
Absolutely. And unfortunately, we do have to take a brief break, but we will be right back after these messages.